A year ago at this time, life was very different for most of us before mask wearing, social distancing, and staying at home became a national pastime. A year into COVID-19, where do we stand today? What hope does the vaccine bring for tomorrow? And what about these new strains that we're hearing about? Where is the world during a pandemic 1 year in? We welcome Kristen Wenrich of the Bethlehem Health Bureau and Dr. Brian Nestor of Lehigh Valley Health Network to break down those questions and more. That's all coming up right here, right now. I'm Sam Chen, and this is Face the Issues. Good evening and welcome to Face the Issues. I'm Sam Chen. A year ago, life looked very different for most of us. We weren't wearing masks, we didn't need to be socially distanced, and most of us weren't staying at home unless, of course, by choice. A year into the COVID-19 pandemic, potentially the worst health crisis in 100 years. Where do we stand a year in? And what hope do we have for the future as we look toward a vaccine? Pleased to welcome this evening Kristen Wenrich from the City of Bethlehem's Health Department. Kristen, welcome to Face the Issues, and thank you for being here, but also thank you for what you do every single day.
Thank you for having me.
And Kristen, it's good to have you. I want to just start by asking for your reflection. You have been at the health department in Bethlehem for about a little over 20 years now, if I'm not mistaken. You've committed your life to public health. COVID-19. Where does this rank on things you've seen as far as public health crises go?
Definitely number one. Certainly we prepared for these types of events, but to the scale and duration that this has lasted, we just had never anticipated anything to this magnitude. Certainly we dealt with H1N1, we had Ebola, Zika, so we were, again, used to dealing with certain health issues, but no one could have anticipated last March when we were first diagnosing our first cases of COVID-19 that we still, a year later, would be dealing with the same situation.
Yeah, I remember going back last March, our viewers know I had COVID-19 back last March, one of the early cases, and having been through H1N1, I remember thinking when this all started, this isn't going to last that long. This is, we've had H1N1, to your point, we've had Ebola, we've seen crises like this, and yet here we are a year later and we're still talking about it. It's impacted our lives, it's impacted everything on the news. How has this been different? Obviously the magnitude, but how or even why, from where you sit, has this been different than, say, H1N1?
I mean, we never could have imagined complete shutdowns of our society where children weren't in school, where businesses were closed. Our sole operations are focused on COVID-19 and have been largely since March. That's definitely been a challenge because we have so many other public health issues that we're addressing on a daily basis. So to really have to take your staff and divert pretty much all of their time dealing with this issue for a year has been extremely challenging. And we know that suicides aren't going down, heroin and opioid overdoses aren't decreasing. We know that these other public health issues are out there, and it's just you don't have the depth to be able to address everything as much as we'd like to.
I think that's a interesting point that people don't always think about. To your point, the opiate crisis didn't just go away. I mean, a year ago, these were things that we talked about regularly and didn't just disappear. And, we see numbers that heart attack numbers are down, stroke numbers are down. They didn't just stop happening, but with all the attention being paid to COVID-19, people even being afraid to go to see their doctors with other conditions, there's an impact larger than just the virus. Kristen, I want to run through some numbers here. Worldwide, and of course, this is as we're sitting here recording today. This is going to change by the time our viewers are watching this. Worldwide, 101 million cases, 2.19 million deaths. In the United States, just shy of 26 million cases, 433,000 deaths. In Pennsylvania, 830,000 cases with 21,350 deaths. And the Lehigh Valley, a little bit above 50,000 cases with a little bit more than 1,200 deaths. You said earlier, this is the magnitude, you've never seen anything like this before. What has it been like working in your position? What has it been like working in public health during this pandemic?
I mean, it's definitely grueling. Again, I think in the beginning we had the energy and it was something new. So we were kind of, getting accustomed to dealing with it. But as it's stretched on, it's a little bit like Groundhog Day. That's the only way to explain it. You feel like every day you come in and it's the same thing. The one thing I love about public health is that we always focused on a variety of health issues. So one day you might be focused on heroin and opioid overdoses. The next day you're focused on, healthy homes, and making sure that homes are free of lead. Another day you might be focused on chronic diseases. So I love the variety and that we provided a variety of programming and not one day was the same. That's really what attracted me to the field. And really, again, since this last year, I feel like every day's been the same. But I think you need to take one day at a time. That's really the only way I've managed. I know many of my staff, we've been working 7 days a week, obviously more than 8-hour days. We've been conducting investigations. Anytime somebody is positive, we need to investigate that case, collect certain information, instruct them what they need to do as far as isolation, and then we need to obtain their contacts and do contact tracing. So we've had to really extend out our staff as well. So our staff, we're a staff of 25 individuals. So we had to hire some outside assistants to be able to help manage just the number of cases to make sure that we were investigating them effectively.
And that has got to be taxing. I imagine, first of all, 7 days a week, that's got to be physically taxing, but I imagine it's also emotionally draining at times. And how do you and your staff, we see so many stories of our frontline workers who they come in 6-7 days a week and they're completely drained physically and emotionally. How has it been for you and your team, and how do you deal with that?
I have a great team. So that's first and foremost. I have really dedicated staff. I couldn't ask for better employees who have put their heart and soul into this and want to see us get out of the woods and get back to some type of normalcy. Again, having some extra outside help has certainly assisted. So we're looking at having some additional assistance with like the weekend work, because the 7 days is getting very, very tough. As we now are ramping up our vaccine clinics, that's added a whole other layer to this. So before we were focused on mainly the investigations, the outbreaks. Now we have to still conduct that business, but we also need to run vaccine clinics multiple days a week, where we're vaccinating upwards of over 1,000 people at one clinic. So again, it's a lot of work, just really trying to be that cheerleader and, tell my staff that hopefully, we're going to be out of the woods or somewhat out of the woods, over the next few months. And they know that what they're doing is making a difference with our community. And individuals that have come through our vaccine clinics are just so thankful, so grateful. They can't say enough about what we're doing. So that is very rewarding. That you're doing something good for the community, and people are just excited to get the vaccine because they can see their grandkids. They can get back to a little bit of a normal life.
I want to ask you about those vaccines. Obviously, Operation Warp Speed and produced a vaccine before the end of last year. And this has been kind of what a lot of us are hanging our hopes on. A number of different companies, Pfizer, Moderna, there's a number of different companies that have made this vaccine. It's here, but the state is, and across the country, all these states are rolling out in phases. Well, the number one question people have is, when can I finally get a vaccine? What has been the situation? You say you guys are doing 1,000 doses per clinic. What has been the situation as far as vaccine shortages, what the expectation is, and when do we think we will be able to successfully vaccinate at least most of Americans so we can start heading towards herd immunity?
Sure. So I think in the Lehigh Valley, we've done a pretty good job as far as when we moved through the initial 1A phase. So if you remember, initially it was really focused on the healthcare workers, long-term care facility residents, and long-term care facility staff. I think we did a really great job here locally vaccinating those groups. We were then prepped to start going to 1B, and I know both health bureaus, Allentown and Bethlehem, as well as the healthcare networks, were both planning to move towards vaccinating some of those populations. I think everybody was taken aback when the state decided to expand the 1A group, with now including individuals over the age of 65, and then including those from 16 to 64 with certain health conditions. And that's definitely maxed out the system. There is a huge group that's part of that 1A expansion. And again, we can't meet the demand with the vaccine that we're receiving. We're hoping that it continues to improve. Up until this week, we have gotten the doses that we've asked for, but starting this week, we did start to see less of a supply coming from the Department of Health.
What do you tell individuals who are trying to get scheduled to get their vaccines? What's your a lot of them are going to be watching this program. What's your message to them as far as when they may be able to expect a vaccine, and what should they be doing in the meantime?
Well, one thing that we are seeing that's causing a bit of a problem is people are booking vaccine at 3-4 different locations. So people need to realize that's taking slots away from other people. So we stress, if you're going to book at one place, book your appointment and keep your appointment at that location, because then we'll get people that don't show up to our clinics, and those are spaces that we could have allocated to other individuals. So I think that's just one important thing to stress to community members. We're also at the point where we certainly couldn't have anticipated that people from other states, people from all over Pennsylvania are trying to get into our local clinic. Our vaccine allotment is really based on, our population size. So although we don't want to turn anybody away because the vaccine is coming from the federal government, we do have to prioritize and make sure that we're providing for our residents here locally.
All right. And those other regions are also getting allotments of the vaccine, correct?
Correct.
Okay. With the vaccine, there's been a lot of talk, obviously, and we'll future episodes of this show, we'll dive more into the vaccine and what an RNA vaccine is and so forth. But there's 2 shots to the Pfizer and Moderna vaccines. And there's a lot of talk about just once you've had the vaccine does not mean you just go out and meet in large groups and you don't socially distance and you don't wear a mask. Why is that? I mean, there's some frustration to say, I got vaccinated. Why can't I just resume my normal everyday activities?
Correct. They're not really sure how infectious you could be, like even if you're vaccinated. So that's one of the reasons that they're still requiring the mask usage, the social distancing. Just because you're vaccinated doesn't necessarily mean that you couldn't pass coronavirus on to somebody else.
Okay.
But the 2-dose series of the vaccine has in the trials proven to be very effective, up to 95%.
And I think we're seeing those numbers. New York Times just had the article recently that as people begin getting that first and even second dose now, we're beginning to see hospitalizations and case numbers start to decline. There was a report out from Israel that where they have successfully vaccinated those 65 and older, now a much smaller population to be fair, but that they are now seeing up to 60% decline in the hospitalizations. So to your point, seems like the vaccine is certainly very effective. What would you say to people who are perhaps reprehensive about getting the vaccine or apprehensive in saying, hey, I'm not sure I want to do or I have concerns about it?
Well, we actually surveyed community members probably about 2 months ago, just looking as far as what the intent was for receiving the vaccination. So we asked if they planned to receive it, and if they didn't plan to receive it, what was the reason why? And I think there was a lot of concern because I think the name Operation Warp Speed didn't really help matters. People thought that this vaccine wasn't going through the appropriate channels of approval, that they were fast tracking things. And although it was fast tracked, when you understand the background to what they were doing, that things were happening concurrently throughout the process, and you had vaccine manufacturers that were producing this vaccine as it was going through the trials because they were given a large sums of money from the federal government to be able to do so. So there's some vaccine that it went into production, and through the trials it was shown not to be effective or that it had adverse outcomes, and those vaccines aren't going to be publicly available. So it was just that things were happening concurrently, and it wasn't that things were not going through the normal process, should I say. I think that seems to be the biggest concern for people, that they felt like it was fast-tracked as far as the approvals and things were skipped during the process.
That's a good reassurance. I used to work for the federal government. I can tell you we do not come up with the best names for programs sometimes. Kristen, last question for you. We're a year into the COVID-19 pandemic. There is hope. With this vaccine, we're starting to see in other places around the world numbers being affected in a good trend because of this vaccine. What is your message for people right now with regards to the pandemic?
I know there's certainly pandemic fatigue. Everyone wants to get back to a normal life, and we're social creatures. People want to be able to go to concerts and parties and have their children back in school. And I think if we can get this vaccine and people take advantage of getting this vaccine when it is widely available, the sooner we'll be able to get back to some sort of normalcy, because we're all, from those working in the professional healthcare fields to, everyday residents, everybody's in the same boat, that we just want to get back to some sort of normalcy. You almost forget what that feels like because we've been living with this for so long.
Yeah. Well, Kristen, thank you again for joining us. Thank you for what you do. And you and your team are really heroes. You've been on the front lines. We thank you. We salute you. And you are certainly in our prayers day in and day out. Thank you so much.
Thank you.
So, when we come back, Dr. Brian Nestor, CEO and president of Lehigh Valley Health Network, will join us to continue this conversation on COVID-19 1 year in. Don't go away. We'll be right back. Welcome back to Face the Issues. I'm now joined by Dr. Brian Nestor, president and CEO of Lehigh Valley Health Network. Dr. Nestor, thank you and welcome to Face the Issues.
Of course, Sam. Good to see you again.
Good to see you as always. Before we get into the questions here, how are you and your family doing, and how have you guys been throughout this pandemic?
Oh, well, on a personal level, doing very well. Thank you very much. We've been, it's been a challenge for everybody. I guess the most notable thing in my family is my daughter has wound up as a site coordinator for 2 COVID-19 testing sites in vulnerable communities in Philadelphia. So as of today, she's in 22-degree weather, with full PPE on, doing COVID testing. So she's the hero in our family. So and it just does highlight how challenging it is for many of our vulnerable communities to get good access to not only care, but the testing that allows them to stay safe. So we're all good. So thanks for asking.
Good. And hats off to her. I remember when she was first going to college. And so to hear that certainly makes me feel old. But hats off to her and to your family for what you guys do. Dr. Nestor, obviously we are a year into COVID-19. I think most people in the public a year ago were doing things very differently. They weren't socially distancing. They weren't wearing masks. We were going to concerts and things like that. And a year later, everything has changed. Now, you've been in medicine for quite a bit as both a doctor and an administrator. How does this pandemic compare to other things you've seen in the past?
Nothing compares. This is different in no matter how you slice and dice it. This is, the category we throw it in is into disaster management, and we're pretty deep in disaster management, emergency service management, hazardous material, crisis management. So we're ready, and we love doing that stuff. So we're quite prepared. I think the good news is that if we've had anything familiar about this, it was with SARS, H1N1. We have always been fortunate here, well before I got here 22 years ago, to have very deep infection control processes. And actually, I just resurrected this story, which many people just forget. But in 2003 with SARS, there were 4 total cases in America that penetrated the United States. And one of them was at Lehigh Valley Hospital in Muhlenberg.
Oh, wow.
It was picked up by one of our ER docs who asked the right questions, found that the patient was not feeling well for several days, asked about recent travel, had come in from Toronto into ABE airport, and before that attended a wedding in China. Sure enough, the patient was placed immediately in negative pressure, contained. 10 hours later, a DC-10 of CDC officials were on site. So we have a lot of experience with surveillance for these types of things. We are one of 4 Ebola centers for the state of Pennsylvania. So I think this is kind of stuff we like to take charge of, but nothing prepares you for this, to answer your question.
Wow. And what are some of the changes that we've seen? I mean, obviously LVHN's had to adjust, but also, other conditions don't just disappear. And I mean, when you look at the numbers, it seems like it almost looks like less people are having heart attacks and strokes and so forth. I can't imagine that being the case. What's led to those number drops? Are people afraid to come to the hospital, and how have you guys adjusted to that?
I think many people are, Sam. I think you hit it right on the nose. And it's changed. Everyone reacts to these circumstances differently. They have different interpretations on whether they wear a mask, whether they should get the vaccine. Maybe we can talk about those things. But there are people out there, and I'm one of them too. I never like going to the doctor. I like to hey, I'm feeling good. Life must be fine. That's not how you manage your health. And people are very willing to look to the first excuse as to why they don't have to follow up for care, or maybe it's no big deal. And I think that's really harmed a lot of people. We are high single digit to double digit lower percentages of MIs, myocardial infarction, heart attacks, and strokes coming into our emergency department.
Wow.
It's not that they're not happening. They're happening at home and people are blowing them off. That keeps me up at night. I worry about that. I would say hospitals are safe. Our doctors' offices are safe. Do not put off your care. We can, as they say, walk and chew gum at the same time. We can take care of COVID-19 people, not get you infected.
Yeah. And I think that's such an important point, because people are afraid, and rightfully so, of COVID-19, the death rate and so forth, but you're not going to be safe if you're suffering from a heart attack or a stroke and not in hospital care. This is all essentially casualties of the pandemic.
You're exactly right. People should prioritize their care. Again, you don't want to infect. You don't want to be typhoid Mary or John, right? So you want to protect yourself. You want to protect your family. But you can go back to your normal engagement with your doctor. The use of express care locations. To get your MRI or CT. We've shown that we can do these extremely safely. And by the way, in particular, we are well below national and state average for the spread of COVID-19. Most of the spread that we have amongst our workforce, below 1%, okay? And most of that, they get it from their community or families. So the hospital is a safe environment. Please, I wish the listeners would take that to heart.
I think that's fantastic advice, Dr. Nestor. And obviously, moving forward, a lot of hope with the new vaccines, whether from Pfizer or Moderna or so forth. But there's also a lot of confusion, I think, among some people, concern of the vaccine, whether it's safe. Perhaps naming it Operation Warp Speed wasn't the best idea, but there's concern with the vaccine. What is your advice to patients and to viewers about this vaccine, whether they should get it, how it's been developed, is it safe, and is it effective?
Certainly in my career medically, I've never seen anything like this. So from that standpoint, Operation Warp Speed was, in my mind, a miracle. To see two vaccines developed within a year, our medical community remains astounded. We do have some challenges now in terms of production and dissemination. That's a challenge. But we have really followed the rigorous FDA approach. I believe 100% that the FDA looked and scrutinized the development of these vaccines in the same way they would have with development of a SARS or H1N1 or even the influenza vaccine. I feel very, very confident about that. We should remember that these are being used now under emergency use authorization, EUA. That is not the final evaluation to get final clearance. However, it is good enough. The safety profile is good enough, and I believe very, very safe, that it can be used widespread across the country. To give you an example of how confident I am in that, I have received the vaccine, certainly. My daughter, as a frontline personnel in a COVID site, she's of childbearing age. She's 24 years old. She has gotten the vaccine. I am not worried about this, okay? Now, I understand, though, that many are concerned that we don't have the final analysis on what happens if I'm pregnant already. What happens if I'm about to get pregnant? We don't have all those answers, and I understand that those are justifiable reasons to be a little cautious, maybe to wait for more data. I get that. But by and large, if you're a healthy individual, or even an individual that has medical risk and conditions, or you are of age with other comorbidities, get the vaccine. That's what we should be doing right now.
One of the other questions that we hear a lot is there are these new strains, these mutations, the British strain from South Africa, the other strain. Do we know if the vaccine protects against these strains as well?
So far, and I'm not the chief science officer on this, but we're two mutations first identified in Britain, the second one in South Africa. It is my understanding that both of those are covered by the vaccines that have currently been placed out there. My worry about mutations are those are the first two. All right, okay. There will be others. And the longer we kind of take in order to get herd immunity, which so many hear about, and that's where you have a sufficient number of community members vaccinated to kind of, if you will, erode and evaporate the virus. the virus remains in the community, ready to mutate. So, and so far we've been fortunate. The first two mutations appear to be something the vaccines can handle. That could change. Another reason for us to get going with this rapid dissemination of the vaccine for all communities.
So is the idea here that we want to vaccinate and achieve a herd immunity before we see more mutations that potentially the vaccine isn't as effective against?
That's one of the reasons, and certainly it's the biggest one in my mind, and why we should be doing everything we can. I think everyone is trying to do everything they can. There's lots of talk about why vaccinations are low, why production is not what it should be, what the problems are between the federal, the state, Pfizer, Moderna, and everyone else. The bottom line is there's not enough vaccine supply out there yet. When the federal government wrote the plan for vaccination around the warp speed approach, they said there would be three phases. The first phase is that production will by no means match demand. And that would be the first few months. So keep in mind, we only started vaccinating at the end of December, and here we are at the end of January. Okay, so we shouldn't be surprised that there is maybe a vaccine scarce environment for even into March. Okay, but then we should slowly get into this longer period, okay, of say 3, 4, 5, 6 months where supply and demand match. Okay, and then after that will be phase 3, where the supply way outpaces the demand. That's when we can really get everybody. But that means that these first 6 months are critical to make sure that we are most delivering the vaccine as expeditiously and efficiently. And I would use this opportunity, if you don't mind, to say the best way to do that is use health systems to do that. We have the capacity, we have the know-how, we have the teams 7 days a week that can deliver this. You know, right now, the most we've delivered in a single day is a little over 3,200 vaccines. Our current capacity is 20,000. We have, and I'm sorry, 25,000, and we've been asking for up to 21,000 doses a week. They just don't. The state doesn't have that stockpile for us, and we're not the only ones delivering vaccine. I would tell you, we could do monstrous more vaccinations. We had, as you know, our first Dorney Park event where you only had enough vaccine to do a little over 1,000 vaccines. We could do 4,500 there tomorrow if we had the vaccination.
Yeah. And last question for you, Dr. Nestor. Also, along with the vaccines, LVHN is rolling these out free of charge to the public, right?
Oh, certainly. Yeah. You know, this is a community health mission. Everyone needs to get it. And I would also like to make this point. I know you care about street medicine and your volunteer work, Sam. And vulnerable populations, of which homelessness is an issue. But there are a lot of vulnerable community members out there living. And what we know is we know where they live. We know where people that are have social and economic obstructions in their life and have other medical problems and don't have access to healthy foods, don't have access to support structures in their life, don't have access to COVID testing or the vaccine. We have to work doubly hard to get that vaccine there. So the good news is that next week you'll be seeing our very first mobile unit out there, our mobile vaccination unit. It'll be like, hey, there's that Action News van again. You'll see that we'll have 4 of those, literally just to get into hard to reach neighborhoods where we know the population there is at risk and vulnerable. But then there's also the mass vaccination of our Dorney sites. We have 3 other sites that the tents are going up. They just went up today at Northampton Community College. Next week, they're going up at another location. We have some big box places available, and that's all in addition to 30 physician practices and 5 hospital campuses. So we have lots of potential here to give vaccine. This is a vaccination issue that can be solved. We can do it. We just need the doses. We have the capacity and know-how. We can't wait to deliver on this mission.
And we can do this. Dr. Nestor, I appreciate your time. I appreciate the work that you and your family are doing. Thank you, and please stay safe.
Thank you, sir.
That is our show for this evening. Thank you for tuning in, and we look forward to for you to join us again next week. Until then, my name is Sam Chen. On behalf of all of us here at Face the Issues, thank you and good night.